everyone, welcome back to Nurse Catherine here. Welcome back to week 4 of NCLEX Lab Value Review. For the last 4 weeks, I've been going through the major lab values that I think you should know before taking your NCLEX exam and what you should be studying before you even sit for your exam, or even truly before you even hit that submit button to take your exam. So before we start, if you have not watched the last 3 videos this past month about NCLEX review lab results, make sure you go check those out. You can find them in this little link above. But other than that, let's get started in today's video for week 4. In this video today, we are focusing on INR, PT, and PTT. These 3 can be easily confused with each other. I know I confused them with each other in nursing school, and I confused them with what medications go with what lab values, and really just trying to figure it all out. So that is why I am going over this with you today, because I believe, trying to think back here, when I took my NCLEX exam, I believe I needed to know at least 2 of these 3 for my exam. So on the screen next to me right here, you will see what we are talking about, the normal lab value, which medication it goes with, and especially for INR, which goes with Coumadin, I'll give you that a while, what foods can actually throw this off and be life-threatening to the patient. Something that you really need to know as a nurse and to even become a nurse. So let's get started. So first, let's talk about PT. Also, you can call it prothrombin time. A PT test, not physical therapy test, but the prothrombin time measures how long it takes your blood to clot in seconds. This is primarily used to check blood disorders and measure the medication that you're taking to prevent blood clotting, which leads me into my next lab value, which is INR. So PT can be expressed in 2 different ways. It can be expressed in seconds or as a ratio, which is your INR. So when you're getting a PT result back, that can actually vary from laboratory to laboratory. So that is why an INR was created, which means international normalized ratio. That way this test result can be normalized internationally. But that's not what is important here. What is important is the numbers that go with these and what foods will affect this for your patients. So let's get into INR. PT we're not too worried about because that differs from laboratory to laboratory, and we want to more focus on INR. That is the more important of those 2. So we are going to focus more on the INR and PTT. PTT we will get into next, and right now we will focus on INR. So your INR, your international normalized ratio, can be a little bit different for every patient depending on what the doctor wants this patient's INR lab value to be at if you are taking Coumadin. So I want you guys to think INR, Coumadin, they go hand in hand with each other. And that is the lab value that you will be looking at if this patient is on Coumadin. Of what I have seen in the hospital and what I have learned, most doctors want their patient's INR to be between 2 and 3 when taking Coumadin. I also have seen that some patients who have a very high risk of clotting, their doctor wants their INR to be between 2.5 and 3.5. And then you ask, what happens if your INR is above that marker of where your doctor wants it at? That means you are at a very high risk of bleeding. If you have ever taken care of a patient who is on blood thinning medication, whether that be Lovenox, heparin, Coumadin, Xarelto, all of those kinds, you notice that they are bruised all over. Their poor shins are bruised, their poor arms. In your elderly patients, you can just see the bruising all over them. And that is because their blood is just clotting too slowly sometimes. Now, what happens if your INR is below that 2 number or the 2.5 or where the doctor wants the patient to be at, that means your blood has a higher risk of clotting and the patient may be at risk of unwanted blood clots. For most of these patients, of what I have seen, they are in close communication with their doctors. There's really cool machines out there now that tell these patients what their INR ratio is. And then these patients are also getting their blood work done all the time, so their doctor can let them know how to adjust taking their Coumadin throughout the day. So let's talk about the biggest vitamin that these patients want to avoid, and this is a big teaching point for nurses when educating patients about a new medication. So for Coumadin, you will want to educate your patient on avoiding vitamin K. The liver actually uses vitamin K to produce clotting factors. So these patients who may be eating this high diet in vitamin K, but then also taking Coumadin, they're not hand in hand with each other. They're not helping each other out. They're actually doing the opposites of each other. You're not educating your patient to avoid these, as we all need nutrients, but you are educating them on limiting their amount of vitamin K. But ultimately, if you are unsure, you definitely need to educate your patient on checking with the doctor of what has been prescribed for them. And lastly, let's talk about our last lab value for this video, and that would be the APTT, the activated partial thromboplastin time. This test as well is also testing to see how long it takes your blood to clot. Unlike INR, this is measured in seconds. Now, the medication that I want you to focus on when studying the APTT time is heparin. This is the lab value that I look at as a nurse when I am taking care of a patient who is on a continuous heparin drip. So a typical APTT time is between 30 and 40 seconds. But if you are on heparin, this is different. A lot of doctors that I have seen want your APTT time to be between 60 and 80 seconds. And that is to help the patient not form blood clots. Again, just like when taking warfarin or Coumadin, you want to avoid those vitamin K rich foods. Not avoid them totally, but of course it is up to your doctor. So if you are watching this and you are not a nursing student, make sure you check with your doctor about dietary restrictions when on a blood thinner. But those vitamin K rich foods, those dark green leafy vegetables, those are the types of foods you want to limit when on heparin. Of course, always tobacco products, you need to just stop in general, but especially when on a blood thinner, because smoking can actually increase your risk of blood clots. Another food, if you want to call it that, more like toxin, would be alcohol. When on these types of medications and your patients are drinking alcohol, this actually increases their risk of a GI bleed. But that is it for today's video, guys. I hope you got some helpful information out of this video on what you need to know for taking your NCLEX. Make sure, please, if you did not watch the last 3 videos about lab values, that you go back and do that. They're not very long. I think this is actually maybe the longest video of them all, because it's so important to know this stuff and help educate your patients on this. Other than that, guys, that is it for today's video. If you liked this scrub top that I am wearing today, make sure to find the link in the description below. It is made by Med Couture, and it's not crazy expensive like a lot of these newer scrub brands. This was not like a $40 top. So make sure you find that description below. Also, don't forget to stick around for Saturday's vlog-style video. Other than that, guys, I will see you on Saturday. Have a lovely day.